Okay, class, we're going on to the hip joint palpation now. We're on page 208 of your lab manual, and we'll work our way down. So we're going to start with the iliac crest again. So we are coming with our hands along the top and coming down until we find that bony ridge like we did before. The next one is the ASIS. To do that, we're going to ask our patient to turn around. And this is the attachment point for the tensor fascia lata and the serratorius. So if we come to the front, we should find two bony prominences, one on each side. Again, we're going to ask our patient to turn back around and face the wall this way. And here, we're going to come off the iliac crest and come down medially and inferiorly to find the PSIS. Moving on to the palpations of the femur, if you could lay on your back, please. We're going to find the greater trochanter. We're going to do this by straightening the leg. You come to the lateral aspect of the hip, and you internally and externally rotate the hip until you feel a bony prominence running over your fingertip with my right hand. That'll be the greater trochanter. That's the attachment point for the glute medius and the glute minimus. Go ahead and sit up on the edge for me, please, Allie. The next palpation point you're responsible for are at the distal aspect of the femur. Scoot up a little more. We'll start with the medial aspect. If we find the joint line between the tibia and the femur and come a little more superior, we're going to find the medial femoral condyle, and even a little more superior, the medial femoral epicondyle. And if we come even a little higher, we might find the adductor tubercle. It's a difficult point to palpate, but do know it is superior to the medial epicondyle. If we look at the lateral aspect of the knee, we might find the lateral joint line, and come up a little higher is the lateral condyle, and even just above it is the lateral epicondyle. Along the front of the knee, the distal attachment point for the quadricep muscles is the tibial tuberosity, a bony prominence in the front of the knee. And if we bend the knee up a little more, we could find just right around here the patellar surface. For the last palpation, we're going to ask our subject to lay on her side, please, on the ground. And we're going to find the iliotibial band. Okay, good, thank you. And what we're going to do is ask the patient to bring the leg up like this, and it's located along the lateral aspect of the thigh.